In 2014, a friend of mine who had already undergone radical prostatectomy suggested to me that I might want to go along and get tested. After the PSA test results came back, which was a PSA level of 7.9, I was invited to go and meet up with Mark Laniado, and he talked me through the various options. He said, Bruce, there's always the option to just leave it alone, but I'm not encouraging you to go with that option at all. It looks to me like you've got a very dark, potentially cancerous area right on the edge, and for that reason, I don't recommend that option to you. Then he went on to talk about radical prostatectomy, and he said, Bruce, I'll be honest with you, that's the thing that I do most, that's where I'm busy every day. But he said, I'm not particularly happy that quite often, even though the Da Vinci system is very precise and very careful to avoid touching your special nerves that look after your bladder and look after your erectile functionality, I have to say that all too often, patients will never regain full control in those areas. And I'm not saying that there is any technique that will give you full control, but you have a much, much better chance if we avoid going in with the scalpel. So I want to talk to you about high intensity focused ultrasound. He explained how there are two guns that are shooting these high intensity ultrasounds into a point when they're aiming, and it's where these two ray guns meet that the temperature gets raised up to 100 degrees Celsius. I was delighted that health insurers do now recognise the value of HIFU, and so for me it was a natural choice. When I had my HIFU, there was no pain whatsoever, and all I know is I woke up the next day and it had been done. They had another look at my prostate gland and they went, wow, all of the bad cells have been killed off, and it looks to me like all the healthy cells are still healthy that they're surrounded. So they were very, very pleased with the result. And of course, I was thinking, what a lucky guy I am. You know, I'm going to get back my fishing tackle functionality, and I've been saved from having cancerous cells escaping out into my lymphatic system and eventually killing me. And my luck continues to hit me when I meet up with people at the Compass support group who very sadly have not gone down the HIFU route. They've gone down the route of radical prostatectomy because perhaps when they met their doctor, the doctor was not having an open mind to the use of HIFU. So for them, it was the only choice that was offered to them. And I feel for those people who are not given the opportunity to really think closely about all these other options because they weren't even aware of them.